Welcome back to the Chatham House Weekly COVID-19 webinar with Chatham House Distinguished Fellow David Heymann. Today we have a very special guest with us, Professor Johan Giesecke, who is not only advising the Swedish government on their response and among a group of high-level advisors to WHO, but he's also a globally respected elder statesman epidemiologist, kind of like David, actually. Just some housekeeping briefly at first. This briefing is on the record, so please tweet away using the hashtag #CHEvents. Questions can be submitted throughout the session using the Q&A function on Zoom. Please do upvote questions you like the look of or are similar to one that you want to ask, because the popular ones tend to get prioritized. So it's a great pleasure to have you both on the webinar this week. I know you know each other extremely well, so I'm hoping you'll feel free to spar off each other a bit as we go through. Why don't we start with Johan? I was hoping you could just do a little brief introduction on how you would characterize the approach that Sweden is taking, why it was chosen, and what's been your experience with it.
I would characterize it as a voluntary, rather soft lockdown, because there are many things that have changed in people's behavior in Sweden, but it's not so much from laws or ordinance, but rather from explaining to people why they should do this and why they shouldn't do that, and most people are following. I find that people are not stupid. If you tell them what's good for them and what's good for their fellows, they understand and they usually do as you ask them to do.
Well, why do you think it's been so controversial? Internally as well as externally, it looks like.
Mainly for political reasons, because I think most of the lockdowns installed or set up in Europe are because of politicians need to show strength, decisiveness, action, and they jump on when they have an occasion. Sweden decided early that we should only introduce restrictions that had some kind of scientific basis. And as far as I know, there's only two of them. One is we should wash our hands, and we've known that for 176 years. And the others keep the social distance. The other restrictions that countries have set up have very little scientific background. Closing your border doesn't do very much. Closing schools, there has been some studies on that, but the jury is still out on that one. Well, that's a few examples.
So are you saying that there's really no evidence base for these lockdowns?
That's what I'm saying.
Do you think they were a bad idea or necessary given different contexts in different countries? Do you see that in any country it might have been a good idea, or do you think that there's never any reason for them?
I think some things, some actions, some behavior in society should be addressed by some kind of lockdown. But the way it's been taking on in most European countries is far too much. I think a voluntary one like we've had in Sweden would work in most countries. People are not stupid in those countries either.
Why do you think you're such a loner in this, and why do you think more countries didn't follow the route you did?
Because politicians want to show action, decisiveness, and do something. I think my main favorite useless intervention is spraying the sidewalks in Asia with chlorine. That doesn't help anyone. It's an environmental problem, but not a contagious disease problem. But that shows that the authorities are doing something.
And do the politicians in Sweden not want to look like they're taking action? Are they different to politicians everywhere else?
I think they've listened a bit more to public health people than in many. I know two of our neighbors by the public health institutes said, what's the word for it? Didn't want the politicians to install a lockdown, but they were overruled by the governments in these two countries.
Okay, well, in the UK, for instance, the government has always said we are being guided by the science. Mm-hmm. You have previously said that you thought that the UK was going in the right direction.
You were
earlier.
And
well, what happened?
a paper from Imperial College happened, which, as far as I know, isn't even published yet. It's never peer reviewed, as far as I know. But that would be interesting to write a book about how a not very scientific paper changed the policy in an entire country.
So are you saying that perhaps the prediction that the health service would be overwhelmed may not have been correct, and maybe we could have got away without a lockdown without being overwhelmed in a health service? Or
I think
we should have done something else?
No, you're touching something there. I think, and that's true for Sweden also. The spread of the disease was slowed down a little by the mild lockdown that we had, and it was slowed down in other countries. So it has helped to keep healthcare capacity enough. But as far as I know, you have an empty hospital standing somewhere in England for COVID patients. And Sweden is certainly, we have had empty ICU beds all along and still have, in case numbers are going down now.
Okay, could I just move to David just for a bit before I come back to you, Johan? David, I wanted to ask why you think there's so much interest in the approach that Sweden's taking, and what strikes you as most noteworthy about what they're doing. Does anything impress you, concern you?
Well, I think the most noteworthy accomplishment in Sweden and in other countries, hopefully, is that people understand how to protect themselves and how to protect others. That's the most important base that any country can have, whether they lock down or haven't locked down, and as they begin to lock down. The other problem in many countries is that the lockdown occurred without any thinking about an exit strategy. And so right now, countries are trying to decide, and Johan, you may want to say something about this, but countries are trying to decide how to lock down and what really should they be watching to see when they might want to decide to lock down again. So all of these things are occurring, but Sweden has put people at the base of this, and I think that's most important for a lasting and sustainable intervention.
I think, David, what you just said about, I don't know any single country in Europe that had any idea how they would get out of the lockdown. The exit strategy was never discussed. So I was saying to myself, when country after country did or took up different restrictions, how are they going to get out of there? Have they even thought about that? But I don't think anyone did when the lockdowns started. So I agree with you.
So,
Emma, lockdowns in Europe were done to flatten the curve, clearly, as Johan said earlier, to flatten the curve at the hospitals, to make sure that hospitals weren't overwhelmed after the lesson that occurred in Italy, where hospitals were overwhelmed. Asia never went to that strategy. They kept a strategy of trying to keep the reproductive number less than 1. And I think that's entirely different than what Sweden has done, which is tried to control an increase in the number of people infected in order that they can let this virus enter as it will, but in a more controlled environment. I don't know if that's right, Johan, or not, but that's my understanding. Yeah.
I agree.
So just to, the Swedish approach has been labeled a huge experiment, but what I want to get is a bit of a historical perspective on so-called lockdowns to look at how we got here. I mean, where did the idea of lockdowns come from? It didn't come from WHO recommended measures. Is it basically an extension of age-old quarantine approach, or is this an entirely new beast? I mean, have we ever seen this before in response to an epidemic?
There were some attempts in the US in the Spanish flu, weren't there? There were some cities that managed to keep the infection out for the first round, but then it came back in the second wave. But there are some examples.
And I think the world was influenced by what China did early on as well. China really did lock down and they stopped international travel. And by doing that, I think nobody would say that they didn't slow down the international spread. They did slow down international spread. And other countries saw this, had an opportunity to prepare, some did, some didn't. But then when it came to deciding what to do, many followed that same example of China because China had reported success with that intervention, which appears to have been successful in some way in keeping the reproductive number down. But now what do you do after you begin to exit from that, keeping the number down?
So this is really for both of you. now that people, some countries are emerging from lockdown, do you think that it is going to be viable for them to kind of shift over to the Swedish approach? Or is that something that you would have had to have pursued right from the beginning, and they're going to have to do something different now? Is it viable to say, okay, well, you know, no more lockdown, we'll go to what Sweden's doing?
Johan.
No, I think you can still get out of a lockdown, but you must do it very gradually and over time, unless you want to have a big wave of cases. If you stopped everything in the UK tomorrow, all the restrictions were gone, you'd have a huge wave of cases coming. So you have to do it slowly and in steps.
So in steps would be towards the Swedish way, because you're not doing nothing. You still have restrictions and measures.
We have measures. You can't be more than 50 people in a crowd. Restaurants are open, but they have to have 5 feet between the tables, and you have to eat at the table. You can't stand up and have your beer. You must sit down and have your beer. There is quite a lot of things that
Well,
yeah,
sorry.
and I would
Go ahead,
expect,
David.
yeah, I would expect also that lockdown will not just be, exiting will not just be all at once. There may be certain regions in England or in Germany or other parts of the world where they feel they can unlock earlier because transmission has been low. But there's a handicap, and that is not understanding who's been infected in the past because of this problem with the antibody testing that isn't sensitive enough to pick all previous infections and is being studied right now in most countries trying to be validated. So unlocking is not just the government says we'll unlock and tomorrow they unlock. And I think they will follow the Swedish model of no mass gatherings, social distancing in places like restaurants, physical distancing, a whole series of things. But it won't be just today we're unlocking. It'll be hopefully a gradual unlocking, like Sweden has done and has maintained. And it's interesting because in Asia, some countries that have been trying to not lock down have begun to lock down certain places in order to keep this reproductive number below 1. And in so doing, they will have a population that's susceptible, and then they'll be in the same situation. What do we do when we exit?
Yeah, so that on not lockdown to lockdown, Johan, I wanted to ask you, honestly, how good is compliance? I mean, might Sweden impose a lockdown in the near or mid future, or slightly tougher restrictions? Because I read this week that you've had to threaten to close down some restaurants in Stockholm.
Yes.
Which is being characterized by critics as the beginning of a U-turn. Is it a U-turn?
No, I mean, 5 restaurants were closed down, but they will open again when they toe the line. I think this is a psychological thing by the authorities to some extent. We're saying now that we can see the light at the end of the tunnel, and then people sort of drop everything and say it's back to normal. And the Prime Minister spoke on TV yesterday, and he was very clear that all the restrictions we have, we keep. We're not changing policy now when things seem to go the right way.
So how much of the core classic outbreak control measures of the finding every suspected case, testing them, isolating and treating them if they're sick, contact tracing, quarantine, is Sweden doing as part of its approach?
It was initially when the cases came back from the Alps during the spring break in the schools. But then after 1 week, 2 weeks, the cases were too many. There were too few people doing contact tracing, and the community spread was evident. But we will have to do it once more, and then that's when we climb down and we're getting closer to the finish of this outbreak. Then we'll do it again for the last cases. Contact tracing, isolation, and so on. Well,
and this is for both of you. WHO keeps saying that for every country, finding every case, testing, isolating, contact tracing, chasing down every contact, that has to be done to get on top of this. And yet so many countries are struggling with it. If they're not doing it, are they doomed? Or how is it an ideal? Would be lovely to have, or is it really a must? And what do we do with that difference between what WHO is insisting must be done and what is actually happening, and what does that mean for our hope?
Emma, maybe I'll step in and just say that good outbreak control requires identification of cases, contact tracing, and isolation of those contacts who are or become infected. That's a standard procedure done in all outbreak containment activities. And what's interesting in this outbreak of this disease is that it can be done as people begin to step down. Germany continued to do it all along. Other countries like Sweden and probably likely the UK and other countries will begin to put that in place when it's possible to do that again. And that will remain a basis of outbreak control. Identification of cases, contact tracing. But WHO doesn't say that it has to be done at all times. What's interesting, as I was going to say, though, is that it's not like influenza. Influenza, you cannot get influenza into a position where you can then contain outbreaks because it spreads in a different manner. Johan may disagree or he may agree with that, but that's my view, that this is an unusual disease in that when countries begin to step down, they can reinstitute again these procedures of contact tracing and isolation of patients and contacts. Johan.
Oh, I agree. And I agree, the WHO isn't saying that you should do contact tracing all the time. I agree with that. And I think it, just like I said, it has to be modified to the situation and the country, and maybe parts of the country, which is legally problematic, I learned, because to make laws that only apply in one county is not easy from a legal point of view.
Okay. This is a question for you, Johan, about Sweden having taken quite a bit of flack on its approach. How tough has that been to deal with? And has there even been a smidgen of a wobble in terms of your confidence in the approach?
There have been instances when that's happened, and the guy who's taken most of the flack is Anders Tegnell, the present state epidemiologist. But it's fascinating, Emma. I've been answering questions from foreign journalists for 4 weeks now. I'm working now for the Public Health Agency. They dusted me off and brought me back in. Is for the first 2 weeks, that's until 10 days ago, all the calls were, what are you doing in Sweden? You're crazy, the Dummer Sweden, you're killing your old people just to get herd immunity. But the last 10 days, the questions from journalists and media have changed completely from one day to the next. Now they are genuinely interested in what we're doing and how it's working. And I can almost say which day it turned. It's no more of this flack that you called it. It's much more serious interest.
Mm-hmm. And do you think there's anything special about Sweden that meant that it was able to take this approach when other countries weren't? I mean, things like, is there something different about Swedish people compared to other people, or the density of your population, or you were better prepared? What is the contextual uniqueness that why we're seeing you do this?
I think this would have worked in most countries. I agree that probably the trust between authorities and the population, or the trust is a bit bigger in Sweden than in many other countries. But even in other countries, people are not stupid. They understand what's good for them and what's good for their fellows.
And Emma,
one more thing, sorry,
yeah.
We're epidemiologists, we only talk about big numbers. And if not 100% follow the rules or restrictions, that doesn't matter as long as 90% are doing it.
And Emma, I just add that I think countries understand, everybody, including Sweden, that one of the most important things to do is to protect the elderly in nursing homes and care homes, and to make sure that government pays attention to that and innovates, because that's an area where government can have a great impact. If they're helping these nursing facilities understand and providing them with the tools that they can use to prevent the virus from entering into those homes. And I think that's what's most important. Others have to learn on their own, but the people who are captive in homes such as the nursing homes must be, their protection must be facilitated by the people working with them and by government stepping in and helping those people protect the best.
So that's interesting you say that, because that's been from the beginning, let's protect the vulnerable and the elderly, but that doesn't seem to have been going very well.
No.
In several countries. What are your thoughts on that, Johan?
We've all failed, I think. We all failed. And nursing homes, care homes are a problem. I think in every country in Europe have outbreaks and problems. I talked to an Irish journalist the other day who told me there were 200 outbreaks in care homes in Ireland. Belgium is having a big problem, many countries. So I think that is extreme. I agree with David, it should be done, but I think it's much more difficult than we thought from the beginning. It only takes one little slip by one person to have it spread in a care home.
Emma, you're on mute.
You're on mute. I can't hear you.
Sorry, yes. Any other final thoughts before we move on to the questions from either of you? This has been really fascinating discussion.
Yeah, I would just say that I think we need to really learn from what Sweden has done, all countries, and they are learning, and I know WHO is learning as well. This has been a ship that's been built as it's sailing, and every country has developed a modification of a basic outbreak containment strategy, some going further than others. But everything is important as we move on and learn from what was successful and what isn't successful. And it's important to remember, we don't really know the destiny of this virus even now as to what will happen in the future with this virus.
I would say that we should concentrate even more on the healthcare bit for the people who are infected. That would be the real thing, the difficult thing. Maybe new drugs, maybe a vaccine, but that will take some time. It's very difficult to prevent people from becoming infected. So you should concentrate on the optimal care for those who are sick.
Okay, so one last little thing before we go on to the questions. If we weren't here, I'm not here, the audience is not here, it's just you two talking about this pandemic, what would you be saying to each other?
Well, we've been talking quite a bit, as you can imagine.
Enlighten us.
We've worked together for many years. In fact, Johan, when he had a sabbatical leave back in the late 1990s, was at WHO helping develop the framework that we now call the International Health Regulation Decision Tree on what might be a public health event of international concern. So there's no one better qualified really than Johan to be advising a government on what's been done. So my admiration is for Johan, and my friendship goes back many years, and I listen to what Johan says.
Thank you very much. What I really fear in the long run from all this are the political ramifications. That's what scares me. When one country in Europe now has a dictator for lifetime, and you see these black forces creeping out of the ground in many countries, that will be the remaining legacy of this outbreak, and it scares
me. Okay, on that note, thank you. Somber ending. Well, beginning of the question Q&A. So I'll go on to the most upvoted question at the moment. Comes from Gil Bates. Oh, sorry, Bates Gil. Oh, apologies if I got that the wrong way around. How to explain the relatively low mortality per capita in other Scandinavian countries such as Denmark, Finland, Norway, as compared to Sweden?
One thing, I think we shouldn't count the dead now, because things will happen and the lockdown has more effect in some countries than in others. We should wait a year and then look back and see how many deaths did we have in each member state. I think the difference will not be that great.
Okay, here is one on herd immunity from Dina Mufti. Please explain herd immunity in layman's terms. How does it protect the elderly and the vulnerable? Does herd immunity take place if people get reinfected with COVID-19?
David?
Okay, maybe I'll start then. Thanks, Johan. Yeah, herd immunity is, first of all, depends on the ability of the antibody or the immune system in people who have been infected to prevent reinfection. And so if people have developed what we call solid immunity to this virus, then as the antibody is accrued in the population from infections, eventually there will be a population that's immune in the majority of people and can't continue to transmit this virus, and others who haven't had infection will be protected. Herd immunity must be very high, though, in protection. In diseases like measles or polio, it has to be way above 90% of the people immune in order to stop transmission of the virus. So we don't know exactly what it will be with this virus, but it has to be very high. And I think experience in Norway, or in Sweden rather, will eventually show us what herd immunity might be sooner than happens in other countries, provided the immunity that's being developed is that solid immunity that protects infection. Johan, supplement.
The term comes from the veterinary field. It wasn't applied to people originally because you're talking about herds of cows or something. So that's a strange reason for this word. But David is describing it very well. The disease wants to infect people around itself, and it's looking around for cases to infect. But at one point, it only finds already immune people around, and then the disease dies out.
Okay, I want to pick up on what that means for Sweden. In some of your previous interviews, you were talking about Sweden, Stockholm will reach herd immunity by X date or whatever. But with the evidence emerging that the antibody response might be weak for some, or that antibodies might not confer immunity, or if so, for who knows how long, how does that affect what you now expect in terms of herd immunity and the Swedish strategy in general?
We know now from several different angles that the immunity in Stockholm County, not Sweden, but Stockholm County, which has 2 million inhabitants, that about 500,000 of the people there have been infected already. So that's about 25% or so. We know that, and it's growing exponentially because, you know, in all of Europe, transmission of this virus is almost at its peak right now. We don't see that, but it's happening around us all the time. It's a bit slower in the countries with a working lockdown, a bit quicker otherwise. But we believe we'll reach herd, if herd immunity is 60% of the population being immune, we think we'll reach that point by the end of May. In Stockholm still, Stockholm County. The rest of the country is behind a bit.
Okay, there's a follow-up question upvoted from Hans Fuchs on this topic, which is Sweden pursuing a herd immunity policy, or are you just saying that a policy of voluntary lockdown compliance works better in the long run than a mandatory one?
You can't have a mandatory lockdown forever. Not in a democratic country. They can do it in China, but in a Western democracy, you can't have lockdown more than, how long could you be locked down for? 3 months, 6 months? So everyone has to release the lockdown or lock up the lockdown. It has to be done everywhere. There's no way it can work in Europe.
And I might add to that it's also going to be important that lockdown doesn't just sequester one population, such as the elderly, because they have to also be mixing within the community, and they must do their own shopping and other things as well. So the unlocking or the transition period can't just sequester one population and say, we'll keep them isolated and the rest of the people go on with life. There has to be an equal approach to this for all population age groups.
Okay, here's a frequently upvoted question from Robert Martin. 86% of the fatalities in Sweden due to the disease affected people over 70. Why did countries get it so wrong when it comes to the elderly population?
Like I said, it's mostly from care homes, from nursing homes, and about 50% of all deaths are in old people from nursing homes. I said, I don't think you can prevent that actually. It spreads, it's too contagious, this disease.
Okay, here's one from John Galani. It seems the weakest link in the chain seems to be the health services. What capacity, hold on, where has it gone? It's moved around, sorry. What capacity is being used in Sweden, and are the health professionals being overwhelmed and catching COVID-19, or are they managing?
So far they're managing, and that was one of the problems with the Imperial paper. It didn't adjust for the ability to build more ICU beds. In Sweden they trebled in 2 weeks. We just ordinary wards were turned into ICU wards. So it wasn't that difficult to increase the capacity quite substantially in a short time. It's never gone beyond 90% of the ICU beds. We always had 10% of the beds empty, and now it's more than that.
So do you think ICU bed capacity is the linchpin between having to go to lockdown and not having to? That an alternative approach could have been, well, let's ramp up bed capacity rather than lockdown, or is that oversimplifying things?
It's probably oversimplifying a bit, but it's not bad as a suggestion.
David, what do you think?
Yeah, I would agree with that as well. And you know, what's even more sad is that countries had the opportunity to prepare when China had locked down, and many countries didn't create excess beds that they might have needed until after they began to lock down. And so everybody was caught off guard on this for various reasons. But getting that reserve surge capacity has always been at the heart of influenza planning and of planning for many other outbreaks. And so countries that didn't have that surge capacity were caught unawares. And the next time, hopefully, they will have that capacity available. And they have developed it now in many countries. And that will be useful if there is an increase in patients requiring hospitalization as the exit strategies and as the lockdown begins to occur.
You're right. And preparedness has been bad in almost all countries. Finland is the only country that really has PPE enough for an outbreak such as this. And everyone else is scouting around the world to buy masks and gowns and stuff. And I can't think of any country that was well prepared when it comes to materials and stuff.
In Europe, but in Asia, Johan, as we know, Singapore and Hong Kong,
yeah, sorry,
and other countries, yeah.
I was just talking about Europe.
Right. The countries that had SARS and MERS corona outbreaks in the past learned, yes, and they really did ramp up their surge capacity.
It's fascinating. I learned yesterday. Do you know how much this blue surgical mask used to cost and what it costs now on the open market? It used to be 3 pence, and now it's £2. Fascinating.
Fascinating.
That I just want to pick up on that pandemic preparedness question. It does make me wonder, was preparedness being done incorrectly? Were they chasing the wrong disease X? Did they do it correctly, but they decided not to follow it? What does this outbreak show us about pandemic preparedness, particularly in Europe? David said that, and you've both agreed that in Asia, they seem better prepared. What does this tell us about what we have to do with preparedness for next time? We were preparing. There were exercises, there were plans. What happened?
Good question. When it comes to material, PPE and stuff, I don't think countries were very well prepared. And we saw exportation limitations from some countries wouldn't export PPE to other countries within the union, which is interesting. But on the other more structural side, I'm not sure that we were that bad prepared.
Well, the surge capacity, what about that? That didn't ramp up.
No, but you can't have what would have been in the UK, a couple of thousand ICU beds standing empty all the time just to be prepared for the next outbreak.
But
you can have a plan that says the minute we move in that mode, we get on it now, not a month later.
And they did, Emma. They did. They took
did?
the XL Center in London and other places, and they rapidly ramped up the capacity. They didn't do it before the outbreak began, as most countries didn't. But as soon as they really realized what was going on, that was and that was part of the contingency planning, I think, in all countries, that they would be able to ramp up, and they had ideas of where they would ramp up. So I think in fairness to European countries, they did have these plans, but they were just caught really unawares. It cost money to ramp these things up, and it just wasn't, something that countries that took lightly. It costs a lot of money to do that. On the other hand, what's happening in all countries that did lock down, and I'm not sure what's happening in Sweden on this, but it is that people who have routine healthcare needs are not being seen as much as they should be seen. And as a result, there's increased mortality in this group of people as well. And there's also this widening of the inequalities gap, which is also very important in health in the future. And I'm just wondering if Johan has any view of what happened in Sweden on people who don't have COVID, but who needed routine healthcare. Are they able to get it? And have they been able to get it?
Well, I mean, that's a balance in a lockdown situation. But I mean, all surgery that is not urgent has been shut down. People are not getting, they have to wait in line. And we haven't seen more deaths from other causes, but there's clearly an underserving for other diseases right now. They have to wait longer, and they're probably more sick when they get into hospital also. That's something that's been observed, that people with heart problems come in far too late now compared to just 2 months ago.
Yeah. Okay, there's a question here from Hannah Devlin at The Guardian. And this, she says, is a question for David. Do you think some of the regions of the UK already meet or are close to meeting the government's criteria for lifting the lockdown? If so, do you think preparations should be made now for an easing of restrictions in areas where transmission is very low?
You know, I don't know what the government is planning, but I think that that would make good sense to prepare for phased in unlocking, which goes to areas where there's less risk. That's just common epidemiological sense. You don't do everything at once. You do an analysis. And as I said, the analysis is inhibited by the lack of understanding of what the antibody testing really is showing. But you do an unlocking based on where transmission is less, hoping that it'll stay lower in that area as you begin to prepare in other areas. So I would think that in the thinking that's going on in the UK, as it is in other countries, is not about just unlocking everything at once, but going where they feel the risk is less, whether it's a sector entirely within the UK or whether it's a geographic region. And I think Johan might have some ideas to add to that as well.
Yes, you're right. It could be geographically different, but also I think in a lock-up, you need to take one action at a time. And you start with, say, let's just take an example, opening the schools again. And then you follow what happens with spread. You have to have good testing and frequent testing. Will that affect the spread? Yes or no? If it does, then you close the schools again. If it doesn't, you keep them open. And then you go on to the next restriction, which may be open restaurants, I don't know. And you check for 2-3 weeks what happens then. So I think the lockup will have to be a long process, months, until you, so it's partly like David said, a question of geography, but also a question of which order you would remove the restrictions you put up.
And I think just to add to that, what Asia has done is really the opposite of what Europe is doing, because Asia is now understanding sectors in their populations that are at greatest risk, and they're beginning to close down certain sectors. For example, in Hong Kong, as students began to come back from mainland China, and some of them were infected, Hong Kong decided that they needed to shut down their amusement areas where people go for nightlife and different parts for a couple of weeks to make sure that that isn't an area where transmission occurs as it did occur in the past. And recently, Singapore has also locked down their school sector, whereas before the sector was open because they felt that now there is a risk in that sector that transmission will increase. So Europe and Asia are really at opposite ends of the spectrum. One is beginning to lock down and others are beginning to unlock. And I think both are able to learn from each other how to go about this.
Okay, here's a question from Ben Wakefield, partial question because we've already covered the other part of the question. There are some who would say that the Swedish government have prioritized the economy over lives and that harsher measures could have protected the population better. What are your comments on that? And I'm going to team it with another question. Sorry about, you thought you were done with the flak, but not done. Is it the case that Sweden over-benefited from all the lockdowns around and that it perhaps behaved selfishly in not following what other countries did? And that's from Simon Kijano Evans. So if we put those two together, again, it's about the wisdom of the Swedish approach.
Well, each country, I'm still talking about Europe, has its own epidemic now. It doesn't, contact with other countries are of no concerned, because each one has an internal moving epidemic right now. So closing borders is a bad idea. But to answer the last question, that means that there haven't been many people from other countries coming to Sweden, or the other way around. So I think the Swedish epidemic is quite insensitive to what others are doing around us. What was the first question again?
That playing off the economy versus lives.
No, I mean, an economy.
Harsher measures would have protected more lives.
We shouldn't exaggerate the effect of the partial lockdown that Sweden has. I mean, the economy is hurting badly. I mean, SAS, the main air company for the Nordic countries, is laying off 90% of its staff. So there are big and small businesses are going out of business all the time now. But probably a bit less in other countries than in other countries. But the economy was never really brought into the equation here.
Well, this is for both of you. This comes up quite a lot, that the lockdowns and the measures are a balance, a trade-off between economy and lives. Do you really think that's what's going on? Is there truth to that, or is that again an oversimplification? Is that a fair comment that it's a trade-off and they are not mutually exclusive, but you know, in what way are they related, and how fair is that to pit them against each other in opposition?
Well, in general, it would always be a problem. If you talk about Sweden, it's never entered the discussion. Many businesses are complaining, but like in any country, government is shoving billions of Swedish crowns into the private sector to help small businesses and help big business to survive, but it hasn't really been part of the discussion if this was an important part of the strategy.
And I think it's the same in all other countries. Human life is what is at the center of this. And that's been the most important consideration for all countries, is how to protect the maximum number of lives when this outbreak occurs. And there are different approaches to that. As transition out of lockdown becomes more important, then there will have to be a decision if countries are trying to decide whether or not they want to lock down again or not. They'll have to weigh this very, very difficult situation of what has happened from the lessons they learned in locking down the economy to begin with. And it's a discussion that politicians will have to have, but certainly the medical community will always stick to its priority of saving lives. And that has to be the way that the medical community moves forward, because the medical community has taken an oath to do that. And very few doctors are willing to put life into an equation that looks at the economy at the same time.
Mm-hmm. And also,
okay, so we've got about a minute left. So I wanted, just before we wrap up, for each of you to kind of give your parting thoughts on this. Who wants to go first?
I'll go first. I'll just say that, you know, as we face this outbreak and as we move ahead, it's not really useful to try to destroy a government and what they're doing. It's more useful to find ways of working with that government, whatever the policy has been, and trying to move forward together, remembering that underneath all of this must be our own understanding of how to protect ourselves and protect others.
Johan.
Will we learn from this? My answer is no. 30 years from now, all this will have been completely forgotten, and a similar thing will happen again. I think human memory is short, and the Asian countries learned a lot from SARS, and they managed to do that. But I wonder, I think we don't. It's costly to keep up plans and be prepared, and at some point say, "Well, we don't have to use that money anymore." Many countries are diminishing their armies now because the Cold War is off, and it didn't take very long between the fall of the Soviet Union and countries in Europe saying, we don't need so many militaries. I don't think we will learn much from this, pessimistically.
Okay, great. On another high, thank you for that. So we've come to the end now. Thank you both so much for your time, and for everybody else, a full recording of this video will be on the Chatham House website earlier than normal, because now we're live streaming. I think it doesn't take long. For journalists who may want to follow up with David or Johan, if you email the press office, they'll be able to set you up. So please join us